Hello and welcome to this session. Today we will explore the principles and practices behind ultrasound and MRI. We'll look at how these imaging techniques work, why they are essential in modern medicine, and their key applications, benefits, and limitations in diagnosis and treatment. Ultrasound uses high-frequency sound waves to create images of internal body structures. A transducer emits sound waves that travel through the body. When these waves hit different tissues, they reflect back to the transducer. The machine then converts these echoes into images. The clearer the boundary between tissues, the stronger the reflection. Ultrasound calculates depth based on the time echoes take to return. The formula involves the speed of sound in tissue and time taken, dividing by 2 accounts for the wave's round trip. Acoustic impedance affects how much sound is reflected. A large difference in impedance means a strong reflection. Ultrasound is used for pregnancy monitoring, abdominal imaging, and heart imaging. It is also used for blood flow assessment and examining muscles. Benefits include no ionizing radiation and real-time imaging. However, it has limitations like poor penetration through bone. Image quality heavily depends on the operator's skill. 3D ultrasound generates images of a baby in the womb. Multiple 2-dimensional images are taken from different angles. A computer reconstructs these into a 3-dimensional volume. This technique helps assess fetal development and detect abnormalities. It provides clearer visualization for both clinicians and parents. MRI uses strong magnetic fields and radio waves to produce images. Hydrogen nuclei in the body align with the magnetic field. Radio frequency pulses disturb this alignment. As nuclei relax, they emit signals detected by coils. These signals are processed to create detailed images. Resonance occurs when RF energy matches the nuclei's natural frequency. The Larmor frequency is determined by the magnetic field strength. It ensures efficient energy absorption by nuclei. This process is crucial for creating MRI images. It allows differentiation between various tissue types. After excitation, RF pulses are turned off and nuclei relax. As they return to alignment, they emit signals. These signals are captured by receiver coils. The computer processes them to form images. T1 and T2 relaxation times create contrast between tissues. MRI is effective for imaging the brain, spinal cord, and muscles. It excels in detecting tumors and soft tissue abnormalities. MRI offers excellent soft tissue contrast. It can produce images in any plane, increasing diagnostic accuracy. However, its high cost and long scan times are limitations. MRI provides superb soft tissue contrast without ionizing radiation. It is safer for repeated scans and younger patients. Images can be taken in multiple planes for better anatomical understanding. MRI is sensitive to small tissue changes, aiding early detection. Its high diagnostic accuracy is a major advantage. MRI's high cost and long scan times are significant drawbacks. It is less accessible than X-ray or ultrasound. Strong magnetic fields restrict use in patients with certain implants. The enclosed space can cause discomfort or claustrophobia. Movement sensitivity can reduce image quality. Ultrasound uses sound waves and reflections to create real-time images. It relies on time-of-flight calculations and acoustic impedance differences. Ultrasound is safe and widely used, but limited by penetration and resolution. It is effective for soft tissue and fluid detection. However, it cannot replace high-resolution techniques like MRI. MRI aligns hydrogen nuclei in a magnetic field and uses radio frequency pulses. It detects signals emitted during relaxation to generate detailed images. MRI excels in soft tissue contrast and does not use ionizing radiation. Despite its advantages, it is costly and has restrictions for some patients. Long scan times and patient discomfort are notable issues. Ultrasound is crucial in diagnosis due to its safe, real-time imaging. It is used for pregnancy monitoring and detecting congenital abnormalities. Abdominal conditions like gallstones and liver disease are assessed with ultrasound. In cardiology, it evaluates heart valve function and blood flow. Soft tissue evaluation and guided procedures benefit from ultrasound. Ultrasound is effective for initial investigation and monitoring. It is preferred in obstetrics, vascular studies, and soft tissue imaging. Its limitations mean it cannot replace other imaging techniques. High-resolution detail or imaging through bone requires CT or MRI. Ultrasound often serves as a first-line technique. MRI is based on hydrogen nuclei behavior in a magnetic field and RF energy. The process involves aligning nuclei and applying RF pulses. Nuclei absorb energy and move out of alignment, then relax. Signals emitted during relaxation are detected by receiver coils. These signals are processed to produce detailed images. MRI provides excellent soft tissue contrast and no ionizing radiation. It is ideal for detecting tumors and neurological conditions. Multiplanar imaging improves anatomical understanding. MRI is sensitive to small changes in tissue composition. It offers high diagnostic accuracy for early disease detection. MRI is costly and less accessible compared to other imaging methods. Long scan times require patients to remain still, which is challenging. It is unsuitable for patients with pacemakers or metal implants. The enclosed, noisy scanner can cause discomfort or claustrophobia. Movement sensitivity can blur images, reducing quality. MRI is advanced for imaging soft tissues, especially the brain and spinal cord. It detects tumors and evaluates joint and ligament injuries. Internal organs like the liver and heart are imaged with high resolution. MRI provides detailed images superior to other techniques for soft tissues. It is a key tool in medical diagnosis. MRI is highly effective due to its sensitivity to tissue composition differences. It is particularly useful for brain and spinal cord imaging. MRI provides detailed, high-resolution images for soft tissue evaluation. It offers excellent soft tissue contrast and no ionizing radiation. Despite its benefits, high cost and scan times are limitations. This is the conclusion of the video. Ultrasound and MRI are vital imaging techniques with distinct roles. Ultrasound is versatile and cost-effective for real-time imaging. MRI offers superior soft tissue contrast and detailed imaging. Each has unique benefits and limitations, shaping their use in diagnosis. Together, they enhance medical imaging capabilities. If you think of any questions later, you can contact us on WhatsApp at 074-8436-1688. Thank you, and we hope to see you again at the next session.